wheelchair brakes. First and foremost, always lock them. Okay, but if you're moving them, unlock them. Okay, but make sure you click them in. That's the big one. You'll see these handles, okay, on every wheelchair. They just make look slightly different. Okay, some of them, like that one over there, you really have to push because it's old. It needs some WD-40. It's all good. I would suggest to you, once you have it locked in, just check it. Okay, because what will happen sometimes when you guys are really nervous is this one doesn't allow you to do it because it's spring-loaded, but that one over there will. It'll hit and engage in the wheel, but not be locked. And then if you were to check it, it's moving. So just push it down. Okay? The other thing that we have are our leg rests. Okay? All these leg rests, most of them, okay, are removable. Okay? Or at least they get to slide away. Right? What you will do, and I'll show it over here, is there's a little lever here, and you push it over. There's a lever here, push it over. If you want to take it off, push it over, and you pull them off. I will tell you, you will try to put them back on. You'll try to put the right one on the left leg, and it's like, this isn't working. So it happens to everybody. Don't worry about it, but just get comfortable. One thing I will tell you guys is this: if you are transferring somebody in and out of a wheelchair, at the very least, the legs should be pushed away, okay? The best thing, the best practice would be take them off and put them down. The issue with that is you tend to lose them. They leave them somewhere, and then you put the patient, blah, blah, blah. But then they're not in your way. If I just slide them, okay, and slide them away. This one's a new one, so it's not going to do it. Some of the older ones, though, and I don't get it all the way back. As the person's moving this wheelchair, it can swing back, and it can interfere with your transfer or your moving of the patient. That's all, okay? The other thing I will say, make sure they're clicked in. You have footrests. Footrests can be put up or down, okay? If you are moving somebody in a wheelchair, okay, they should be, unless they're using their feet to propel themselves, and I'll get into that in a second, they should be in the foot plates with the leg rest. What you will see oftentimes, and I think you will see it too, and I've seen it, you guys have done it, not you guys, on practicals and things, is you've done a great job of moving these out, putting somebody in a chair, and now you want to go out in the home and do gait training. You say, okay, Mrs. Smith, let's just pick your legs up. Let's go. Okay? It happens all the time in nursing homes and things like that. The issue, and I'm not picking on nursing homes, it's just that's the facility that you're using a lot of these with. The issues with that is, number one, not standard use of the wheelchair. It takes 2 seconds to put them in. Okay? The other thing is as I'm maneuvering Mrs. Smith, I can be hitting the legs and things like that. Or one leg can be stuck in the door, and they rotate. Or they get tired, and their legs fall, and you're talking to them, you're saying hi to the nurses, and the patients engaged, and then all of a sudden their foot gets run over by the wheelchair, stuck in the tire, things like that. So not a good thing. Keep them in their feet, all right, or keep them in the leg rest, all right. I will tell you this, though, there are some patients that, for whatever reason, they are in wheelchairs and their legs are stronger than their arms to propel themselves with. You see this a lot of times with stroke patients. You will see it with your generally deconditioned patients where they have a hard time propelling themselves with their arms. Your elderly patient. So what oftentimes happens is they take the leg rests off. It's completely appropriate, and they propel themselves with their feet. They're amazing. You can't keep up with these people. I'm not, and then they're turning it and all that. It's okay. But you need to make sure and ensure that they are safe with it, that they're not going to have a leg drag and get caught under a wheel or things like that. And most of the time they don't. So you just need to make sure of that. If they propel their wheelchair by their feet, that is okay to not have the leg rest there. If not, put them on. Okay? Off of that soapbox. You'll see I'm on a lot of soapboxes today. It's all good. You're my last group, so watch out. Armrests. I hate this wheelchair. For armrests, and it's on the videotape, so here we go. Because it's two-pronged here to get it off. Most of them just have this little button, and you pull up, and you get the whole thing off. This one, okay, has this little pull thing here, okay? So what I do is I pull that, disengage it. All right, here we go. falling every time. Because it's old and it's not coming out. Son of a gun. Don't take this on the film. No, kidding.
I'll edit it out.
Edit it out. There we go. Okay? This can tilt back or it can completely come off. The issue is that with all of us, let's get this thing off. It's all rotated and just lousy. I don't like the two things because you got to disengage one and then it cocks it up and all that sort of stuff. But it's nice that you can just rotate it back, okay? Because what happens is you rotate it back and you take it out of the way. And then you just bring it back on, okay? Very simple. These other ones, you have to take the whole thing out. With any of these, if you look at how these are positioned, okay, the armrests are back. It makes sense. We want them in a good position. We want them back in the seat, and their arms are right there. But when we're attempting to get somebody up and out, as Rachel said, up and out of a chair, we're putting their arm, and you say, push off the arm, push down on the armrest and get yourself up. We're setting them in a posterior moment, right? Well, what you can do, as a little trick, okay, is turn, this one's not going to work, but turn them around, okay, so that the armrests are in front. Let me show you. You guys are going to be like, huh? I turn this. See, I can get one on. So, look at how much forward this armrest is from this. Obviously, I turn this one around too. And then what it does, is it gets the person forward and then up. Here's the kicker though. Driving Mrs. Smith around, you're working on sit to stand, you move the armrest like this, and now you say, okay, she wants to watch Oprah. Okay, you leave her in a wheelchair. You need to reverse these back, because what's going to happen is they get tired, and they want to have their arms on their armrest, and that's what keeps their posture. Well, if their armrests are up here, what do you think I'm going to do? Okay, so switch them around. What do you think these are?
Wheelie blockers.
Yeah.
Wheelie blockers, anti-tippers, okay?
Yeah.
What will happen is people in wheelchairs will try to will have to get up inclines or get up curves, okay? Or they're just playing with things and they're attempting to learn sometimes even how to do a wheelie, okay? Which is a very important concept of mobility with a wheelchair, especially for the younger population, because it allows them freedom to interact with their environment. However, it's very dangerous because if you can't control it initially, you go this and boom, you tip right on over, okay? And then not only your spinal cord, your head injured. That stinks, okay? So these block it, okay? And as they're progressing, you can move them up and down to allow for more freedom, and then you can take them off. What do you think these are for? Are these going to stop tipping? No.
No.
What do you think they're for?
Just angling it
Headlights?
back.
Rear lights?
If you want to just tip it to help them up a curve.
Exactly.
Yeah.
It's a biomechanical help assist to help tip. Okay, people are heavy, these things. Okay, and so.